joint replacement is now so successful. I mean, hips, you get a 98% success rate, knees, 95%, and it's now into shoulders, where there's a brilliant new operation for shoulder arthritis. They're starting on ankles, small joints of the hand. For mobility, it's become surgically safe and surgically relatively atraumatic. In the olden days, when you had your hip done, you were in hospital sometimes for 2 weeks. Now you're out in 2 or 3 days. But just recognise that every now and again these things go wrong. And when they do go wrong, you can be in real strife, either from complications of the operation with sepsis and bleeding, or longer term ones like joint dislocation and joint failure and so forth, and wounds failing to heal. And if that happens, then you really can't manage. So I like to say to people, before you have a joint operation, go and talk to somebody who doesn't operate, who hasn't got a vested interest in the procedure. So go and get a referral to see, say, a geriatrician or a rheumatologist if your doctor thinks that's appropriate, and talk it through with them as to whether you're on maximal drug therapy, where you've got the right exercise program, where you've got the appropriate props in place. I mean, sometimes hip arthritis, it's markedly helped by a walking stick. And so that may put off the operation for a couple of years. So don't rush into it. And in the end, I say, get it done when you can't manage, because then if things go wrong, you still can't manage. I mean, I had a friend who had a hip replacement. Basically, he couldn't play 18 holes of golf. He could play 9, but he couldn't get round the second half. He had the hip operation, he had recurrent dislocation, he had to have it redone. He then got sepsis and infection and a non-healing wound. It took him 2 years to get better. And all he had to do was limit it to 9 holes of golf, and he was fine. So just think about that. And remember, and this is a real issue, if you're a public patient, currently in this COVID climate, your chances of getting a joint replacement are almost zilch at present, because very few of them get to category 1. Mostly they're category 2 or 3, and they're just not getting done at present. If you're privately insured, you can be done when you're ready.